If you want to be strong at 85, the work starts now, not with a sprint but with a step. And that brings us to something just as vital, yet often neglected until it is far too late: the quiet but potentially devastating mistake of skipping regular preventive checkups. Now I want you to imagine this with me. You are driving a car that has served you well for decades. It still runs, does not make strange noises, and has not broken down. But you have not checked the oil in a while. You have not looked under the hood. You figure if it is not broken, why fix it? That is how many of us treat our bodies after 60. We feel okay, maybe a little tired now and then, maybe the occasional ache, but nothing serious enough to cause alarm. So we skip appointments. We push off screenings. We tell ourselves it is all part of aging. But here's the truth most people never hear until it is too late. Some of the most dangerous conditions that shorten lives after 70 do not come with warning signs. High blood pressure does not hurt until it damages your heart. Type 2 diabetes can silently eat away at your energy, your vision, even your kidneys, long before you ever feel its full effects. Cancers, particularly colorectal or prostate, often develop in stealth, whispering their arrival in ways so subtle that only a trained eye, through timely tests, can spot them. I have seen it again and again. A man who looked 10 years younger than his age suddenly ends up in the emergency room. A woman who walks 2 miles every day, shocked by a diagnosis she thought could not apply to her. The common thread: avoided checkups. Not out of laziness, but out of fear. And I get it. The fear of hearing bad news is real. No one wants to be told something might be wrong. But here's what I tell my patients: fear does not protect you. Awareness does. Knowledge does not shorten life. It can save it. Take Evelyn, a 72-year-old former teacher I have worked with. She felt fine overall, but her daughter nudged her into booking a routine screening. What they found was early-stage prediabetes. No symptoms, no warning. Just a silent threat waiting to grow. But because they caught it early, Evelyn made a few small but meaningful changes. She swapped her nightly dessert for fruit, started walking 20 minutes after lunch, and checked her glucose monthly. A year later, her numbers were back in a safe range. No medication. No complications. Just the power of early detection. When you consistently monitor your health, you are not just managing numbers on a chart. You are reclaiming control. You are giving your future self a fighting chance to thrive, not just survive. And here's something even deeper. Staying informed about your body is an act of self-respect. It says, I matter. My health matters. My life is worth caring for. The emotional benefit of that mindset cannot be overstated. It replaces helplessness with confidence.